Come Monday, the City of Madison will reframe how it responds to 911 calls for nonviolent mental health concerns, turning over responsibility from police to a brand new service. Adam Duxter joins us live from Fire Station 3 with why city leaders across the board say this couldn't be coming at a better time. Adam.
Madison's mayor says even prior to the pandemic, Dane County was responding to about 7,000 mental health related calls each year, and oftentimes sending a uniformed police officer could only escalate the situation. And today they're hoping the creation of this CARES group and the addition of this van will be the first step in making real change.
Madison's Central District has a new first responder vehicle, one that come Monday will serve a purpose the city has never seen.
We know that people can feel confident calling for help for their loved ones and knowing that they're going to get the support and the treatment that they may need.
The CARES van will be staffed with 2 medics as well as 2 specialists from the Journey Mental Health Services team. And when calls come into 911 for nonviolent mental health crisis situations, a dispatcher will send the CARES van to respond instead of police.
As a former paramedic in the City of Madison, there was always calls that as a paramedic that we went on for mental and behavioral health type emergencies that fell outside of our protocols.
Well, MPD does have officers trained specifically for mental health situations. First responders know often a police officer's presence can make matters worse.
And there are many times where people are very receptive to having a mental health officer come to them in what is clearly intended to be a helping role and connecting them to resources. And there are many times where, regardless of the role of police, people just don't want to have any contact with law enforcement, which is totally understandable.
And simply put, these people are patients. And if they need to be in some type of medical system, they don't need to be in the law enforcement side in the law system.
Madison joins cities like Eugene, Oregon, Austin, and Dallas in programs like this and say, well, it does come with a $500,000 investment. It's money well spent.
We have, as a society, have become over-reliant on law enforcement as our first responders to behavioral health crises. And there are so many situations where that is just not necessary and not the appropriate response or even the helpful response.
And the biggest limit to this CARES program will be the fact that they're starting with just this one van and just 4 employees who will only work 8 hours a day during the week and only serve Madison's Central District. And those who are operating this program say all of that was taking into account the fact that that's where they're seeing the calls and that's when they're seeing them. But say as time moves on in the years past, they hope to expand this program even more.
Adam Duxter live tonight. Adam, thank you.